An operator will be with you momentarily.
Number, please.
948-4167.
May I have your first and last name, please?
First name is Mark. Thank you for joining today's conference call with Governor Andrew Cuomo. I will now turn it over to Governor Cuomo.
Hello, this is Governor Cuomo. Today is day 247. I'm joined by Melissa DeRosa, Robert Mejica, Dr. Zucker, Beth Garvey, Gareth Rhodes. Positivity in microcluster zones, 3.5%. Positivity statewide without the microcluster zones, 1.4. Positivity with the microcluster zones, 1.7. We are still the third lowest state in the nation. Only Maine and Vermont are lower than we are. 14 New Yorkers passed away from COVID yesterday. There are no thoughts and prayers. Hospitalization, 1,151, 276 in ICU, 116 are intubated. New York is in the midst of the sea of division and COVID increase. All around us, the COVID infection rate is going up. You see it in states all across the nation. You see it in countries around the globe. And you see it in contiguous states. New Jersey, Connecticut. Connecticut may be changing their restrictions. New Jersey may be changing their restrictions. Pennsylvania has a real issue. So we should be on high alert, and we should be even more diligent because the virus spreads and it just goes across state boundaries. And we're in the party season, Halloween, coming into Thanksgiving. Students are going home. All I can do is warn New Yorkers and ask them to remember what worked for us. And what worked for us is discipline and smart. That's what works for us. And we have to keep it up because these are dangerous, dangerous times. We're going to stay with the microcluster approach. It has worked. But I'm telling you, these are danger signs all around us. Another topic that is very important that we need to focus on, we, the collective we, the vaccination program is going to be the most labor-intensive task that we have undertaken. It will be the greatest operational task government has undertaken through this COVID pandemic. what you've seen is governmental incompetence exposed, right? My theory is you've had government that has atrophied. You have government leaders now who are not really government leaders. They are politicians who said the right thing to get elected, but many of them are not competent, qualified government leaders. And you're seeing the difference now between government competence and incompetence, and you're seeing the difference between a government leader and a person who was elected to office but was not a government leader. When you see what we have to do for vaccines, is going to be even a more rigorous test. Testing, management of the hospital system, contact tracing were the most rigorous governmental challenges we faced to date. Required hiring thousands of people, setting up hundreds of sites, massive coordination. Some states did it better than others. Our state, he says with all due humility, on the numbers, New York State has done it better than anyone else. Vaccination is going to be more challenging than anything we've done. The federal government is designing the vaccination program. The vaccination program they've designed is very simple. Big Pharma will produce the vaccines. As they're produced, they will become available. The military will be in charge of shipping them, although the military says they're going to use commercial shippers like FedEx, another company called McKinnon, and they'll ship them to the states. And then the states will be responsible for the distribution, except the distribution mechanism that the federal government has designated is the traditional private health infrastructure. The same way you'd get a flu vaccine. You can go to CVS, you can go to Walgreens, you can go to your doctor's office, you can go to a hospital. That infrastructure, number one, is incapable of expediting the vaccination process. How do you know that? It is the same infrastructure we use to do testing. And that infrastructure has produced 120 million COVID tests over 8 months. The infrastructure would have to do 330 million dosages, twice 660. If it took that infrastructure 8 months to do 120 million COVID tests, how long does it take that same infrastructure to do 660 million vaccines? Okay? It's math. Second, the infrastructure will have a discriminatory effect because the infrastructure does not exist to the same extent in poor communities and black and brown communities. And the black and brown communities are the communities with the highest COVID infection rate and the highest COVID mortality rate. So if you had to do any prioritization, you would say give the vaccines to the communities that have the highest infection rates. That would be the black and brown communities. Give the vaccines to the communities that have the highest mortality rate. That would be the black and brown communities. Give the vaccines on a priority basis to essential workers because they have to go to the hospitals every day, etc. That would be the black and brown community. This infrastructure doesn't exist to the extent necessary in the black and brown community. Yesterday you heard from the Attorney General, Tish James. You heard from the national head of the NAACP, Mr. Johnson. You heard from the national head of the Urban League, Mark Morial, who all made the same point. new issue. The federal government just sent out a data sharing form agreement to the states, where the federal government says, before we send you the vaccines, we want a data sharing agreement where the states will share patient information with the federal government. Now, health information is normally private, HIPAA laws, etc. The federal government, why they need any patient data, I have no idea. But for a state to be eligible to receive the vaccines, they want a data sharing agreement. What information do they want from the patients? They want the name, they want the address, they want the date of birth, they want the ethnicity, they want the race, they want the sex, and then they want the ID number. What is an ID number, you ask? Or you would ask, if you could ask. The ID number is normally a driver's license number, or a passport number, or a social security number. That is what the ID number normally is. The data use agreement says that the information will be used by, and I quote, CDC, HHS, and, quote, other federal partners. Now, I have been down this road before. This is an administration that has, from day one, with the wall, been relentless in their pursuit of undocumented people. When we did the driver's licenses for undocumented, they extorted the state. They broke the law to try to get the undocumented driver's licenses. They removed us from the Trusted Traveler Program to extort me to give them the undocumented driver's license list. They caused us great damage by removing us from the Trusted Traveler Program, which actually facilitated national security. But it was done by Department of Homeland Security and their ICE thugs, Chad Wolf, Ken Cuccinelli, who are just thugs and criminals. They extorted the state. They lied. Oh, how can you say that? Because the U.S. attorney said that when they threw out their lawsuit because they lied in the court papers. And it's now being investigated by the Inspector General of the Department of Homeland Security, who is their Inspector General. Do you know how egregious something has to be for a Trump Inspector General to investigate a Trump agency on an immigration matter? So now this is a redux. For the vaccine, you have to give us the information of everyone who's going to receive the vaccine, including the ID number, which will be shared with other federal partners. Other federal partners include Department of Homeland Security, include ICE. Why would you possibly need a person's driver's license number or social security number or passport number before they receive a vaccine? Why? There is no legitimate health reason. This is just another example of them trying to extort the state of New York to get information that they can use at the Department of Homeland Security and ICE to deport people. That's what this is. I will not do it. I wouldn't do it when they extorted me on Trusted Traveler program. I won't do it now. Any Democratic governor that agrees to give them this information, I think either doesn't understand what they're doing or doesn't understand what it means to be a Democrat. So I am saying back to the CDC and HHS, I'll give you the name and the address and date of birth, ethnicity, that's all relevant, sex. But why do you want the driver's license number, passport, or Social Security? What legitimate health reason do you have? And that's the question I'm posing to President Trump and Secretary Azar and Dr. Redfield of the CDC today. Why do you want that information to administer a vaccine program? This is on top of the question I posed yesterday. How can you expect the private health providers to adequately provide for the black and brown community? I believe not providing state government with funds to supplement the private provider network is discriminatory, and I believe it's illegal. If they provided me funds, I could supplement the private provider network, just like I did with COVID testing. We could provide it in public housing. We could use faith-based organizations like we did with COVID testing. I could supplement the private network. Second question, why do you need this information from people? What other federal partners do you want to share it with? Will you say it won't be used for immigration? Or is this just another backhanded way to extort the state? Operator, questions?
If you would like to ask a question at this time, please press star 1 on your telephone. To withdraw your question, press the pound key. Please stand by while we compile the Q&A roster. Your first question comes from the line of Morgan McKay with Spectrum News. Your line is open.
Hello, Governor. How are you?
How are you? Very fine. Thank you for asking.
I'm doing well as well. Thank you. So I had a quick question for you. So with the election day being tomorrow, there are most likely going to be protests across the states. Is the state doing anything to prepare, and do you have any message for people potentially looking at going out to vote or go out to protest after election results roll in?
Look, people have a right to peacefully demonstrate. People don't have a right to break the law. And we're very clear on the distinction, and the distinction will be enforced. I understand the emotion around this election, but before people get upset, I think it would be good to find out what the election results are. You know, you want to be upset that one person didn't win or the other person didn't win, then let's find out what the election results are. And we won't have that until the earliest, late tomorrow night. And it may go beyond that, given the unique circumstances of this election. So I understand the emotion. You can demonstrate peacefully. Remember, COVID is a real problem, especially given these aggravating circumstances. But my point of curiosity, you're upset. How do you know you're upset until you know the results of the election? Next question, operator.
Your next question comes from Kevin Tampone from Syracuse Post-Standard. Your line is open.
Yeah, hi, Governor. Kind of two questions for you here. I know you've been talking a lot about Thanksgiving the last couple of weeks. I'm curious to get your thoughts on the day after that, Black Friday shopping. Just kind of looking for your thoughts on whether that's something people should be considering going out and doing. But then also I'm wondering if you are going to be taking any extra actions with stores, with businesses in terms of extra enforcement or extra guidance around that particularly busy shopping day.
It's a good question, Kevin. We're considering extra guidance. We don't have any yet. But my point is going to be made repeatedly, and I know you're on these calls because I read your stories. Thanksgiving, Black Friday, the whole weekend travel back and forth, it's all bad news when it comes to the possibility of a COVID increase. It is all bad news. You can shop on Black Friday. The same rules are in apply, but people have to exercise diligence, the masks, the social distancing. It works if you do it. And again, just look around. Just look around. Be aware of your circumstances. Look at New Jersey. Look at Connecticut. Look at Pennsylvania. Look at France. Look at the UK. I mean, look at the Dakotas. Look at California. Look around, and you see where we are. And it's not that I'm being overly dramatic. I mean, just look at the facts. And people have to be careful. But we don't have any extra guidance at this time. Next question, operator.
Your next question's from Jeff Kulikowski with News Channel 9. Your line is open.
Good afternoon, Governor. How are you?
Good, Jeff. How are you?
Good, thanks. I'm curious if you have any update on the status with the Buffalo Bills and Bills Stadium about allowing fans in a limited number.
No, same thing as I said yesterday. We are working at it. We're looking at stadium designs. We're studying what the NFL has done in other states. We have sent people to other states to observe what their stadiums are doing and how it's working. Remember, the context here is we already have an issue in Western New York with the infection rate. And I am a Buffalo Bills fan, and they had a great day yesterday. They're having a great season. Beating the Patriots is a special pleasure, even though the Patriots did help us during COVID. Don't forget, the owner was sending his plane to China, and they brought us back masks. But still, beating the Patriots was a big deal. I would love to see fans in the stand. I would love to be at the games. But don't forget the context. Western New York has one of the highest infection rates in the state of New York. And it has, for weeks, been problematic, right? So that makes it more complicated. I would love to do it. I know Western New York would love to do it. We're studying stadiums. We're studying capacity. We're studying the best way to do it. I'm looking at the drawings of the stadium myself. We invested money in the stadium. We understand the stadium. But the context is important, and we're working on it, and there's no final decision. Operator, let's take one more.
Okay. Last question is from Lisa Rosner with CBS News. Your line is open.
Hi, Governor. Thanks for taking my question. I had a question about the new travel policy that you announced over the weekend. Is there a uniform way that the state is going to monitor that everyone who wants to take both these tests and test negative, is there a way that the state will keep track of this, or is this, again, really more of an honor system?
No, we keep track of it. Beth, Rob, do you want to speak to this?
On the tracking, we do keep track of everyone is required, and Beth can speak to this, but we get the tests when individuals come into the state. You're required to submit the test right when you come in, and we're also tracking the second test. So we will be tracking, and everyone is going to be required to submit those tests, and the Department of Health would track when those negatives are received in order to eliminate the quarantine. Otherwise, the 14-day quarantine will remain in effect for those individuals that do not have the 2 negative tests.
Beth, do you have any comment?
Yeah, so this is going to be tracked in the ComCare. ComCare is the concept of New York City are doing. We'll also New York City for investing. Remind that in New York State is reported to the Department of Health and also the local departments of health for their data tracking and contact tracing purposes.
Yeah, Beth was breaking up. I think what you were saying, Lisa, is when you come into the airport, first there are personnel in the airport. Your test is entered into what they call the ComCare system, which is then monitored by the local health departments. And we also have personnel at the airport who could very well stop you and say, can I see your test results? When you go for the subsequent test on day 4, if you do, that test gets reported to the New York State Department of Health. So that will link up with the test you provided from the airport, right? And we'll know on day 4, the state will have a record as to whether or not you got a test and what that test said. The other problem you could really have is if you wind up being sick and you go to a hospital or to a doctor and you test positive and you were not at home, then we'll know that for sure. Just to reiterate on the vaccination, the ID number, I'm sending a letter to the CDC, the President, HHS Secretary. Why do you need an ID number? Why do you need a passport or a license or a Social Security number to do a vaccine? Who will you share it with among your other federal partners? Will you say that it won't be used for immigration purposes? And again, why do you need the ID for a public health purpose? Who are you going to share it with? How do you protect the privacy of it? Or are you coming up with a whole new ID system for people in this country? But I'm not going to give information that could be used to deport people and put them in a situation where either you get a vaccine, but to get the vaccine, you have to give people information so they can deport you. I'm not going to do that. Okay, guys, thank you very much.
Ladies and gentlemen, this concludes today's conference. Thank you for participating.